about healthcare, your doctor, a large healthcare system, your insurance company?
Well, our next guest says you're the one in control of your family's health, probably a lot more than you think, too. Dr. Madan Kandula is an ear, nose, and throat surgeon, and I bet you people don't know what their choices are really. They're so used to being told what to do by their insurance company or maybe by their doctor that they don't realize how many choices are out there.
Yeah, no, this is the best country in the world, I agree, I think. And our healthcare system, while it has its flaws, it is the most patient-centered healthcare system in the world. So people, you have control over your own health. You have control over where you go to get something done, who you see to get something done. And people don't recognize that fact. I mean, I think a lot of folks kind of are stuck in the old mentality. Back in the day, HMO systems were dominant, and back in the day, it was sort of mandatory that you had to get a referral, and you kind of had to go do the right thing and kind of, sort of stand in line and do whatever you were told. That's a thing of the past for the most part. There still are some HMOs out there, but most folks have complete and total control over their health care. They can do and see and go to wherever they want to go to and wherever they think is going to be best for them.
How do you know the difference between needing a referral and just making a choice on a specialist? And then once you know you can find a specialist, how do you go about finding one that you think will fit your needs?
Yeah, I mean, it's pretty simple. I mean, you can ask the question. Typically speaking, if you have insurance, you can ask the question of your insurance, do I need a referral to see a specialist? And 90% of the time, the answer is going to be no. And if you do, then it's, well, okay, I want to see this doctor, and all that means is that you just need a, and usually the specialist office will coordinate that. You'll say, I want an appointment, and then they will contact your primary care physician and figure out what they need to do to get a referral. That's what we do in our office, which is real simple.
A lot of people think that insurance plans require a referral, but that's not necessarily the case, right?
Almost hardly any of them do. And really all you have to do is, look at your insurance, look who's on plan, who's in network of that plan, and you can see whomever you think is best for you.
Before this segment, we mentioned that you actually encourage people to get a second opinion. I think it takes a lot of confidence as a doctor to say, yeah, go ask someone else what they think. Here's what I think, but you should ask someone else too. Why do you encourage that sometimes? I mean,
it's not in every patient sort of a thing, but I think there's certainly patients that either we're just not on the right, or we're not on the same wavelength, or there's just something that just doesn't seem right, or I'm not able to bring them the care or the technique that needs to happen. And in that situation, by all means, I mean, it's really, everybody ought to be on the same wavelength, which is trying to do the best for the patient. And in that line of thought, sometimes I'm not able to give them everything that needs to happen. Sometimes it's just more a matter of, somebody's just not really, what's happening to them isn't exactly the way I want it to play out. Is there something different that's out there that I'm not thinking of that I can't deliver? And if that's the case, great. If it's just confirmation that we've done everything we can do, everything's doing as well as it can do, that's something too.
If patients want a second opinion, or you're not, as you say, on the same wavelength, do you suggest to them maybe where they can go, or is that something then that they need to go back and talk to the primary care?
Whatever. I will, typically speaking, if it's somebody I'm seeing and I'd say, I think it might be a good idea to have another set of eyes on this, I'll typically try to coordinate that to make it easier for the patient. And unless they feel more comfortable but going back to the primary care doc, or just looking around and seeing if there's another option for them. I'm
sure there have been times then that you've told somebody or suggested that they get a second opinion. Have you been happy with the results of that recommendation?
Yeah, I think so. Absolutely. I mean, I think it's more information, and more information is good. And typically, I mean, if things are going well, it's easy. We don't need to worry about second opinions. I see lots of folks in a second opinion. So I see lots of folks who have seen somebody else and kind of have a set game plan or thought process, and we kind of just look at the information and I give them my 2 cents, and a lot of times that's consistent with what they're hearing. Sometimes it's inconsistent, and then it's more a matter of, well, what's the best fit for you?
As a patient, I don't know if I would feel comfortable saying, well, I'm not sure that you're the direction I want to go. I want to see someone else. How can a patient know when that time is right to get a second opinion, and how would you suggest they go about talking to their doctor about it?
It can be a little awkward, but you go with your gut, and if your gut says, I'm comfortable with what I'm hearing, I feel like I'm hearing all my options, this seems like a good idea for me, that's great. If your gut says, I'm not sure, and not sure is not sure. So not sure means maybe I just want to hear another sort of take on this, and that's fine. And if somebody has a problem with that, then I go with your gut too. And if somebody's got a problem with that, then I'd say, well, why do you have a problem with that? It just seems a little, it shouldn't be confrontational, I guess is what I'd say.
I wonder about family doctors too, because they're sort of the front line sometimes in terms of recommending a specialist or sometimes seeing somebody else who's got different kind of expertise. A majority of family doctors used to be independent. It doesn't seem like that's the case necessarily anymore.
Yeah, and it's a tricky these days. So almost all, like 95% of primary care doctors are employed by a healthcare system. And back before they were employed, they could say, well, this is the best person for you, and they could send somebody to see whomever they wanted. Nowadays, they don't have that choice. They've got to say, you know, I've got to send you to the doc that's in my system, whether it's the best choice for you or not. And they can't say that, and it's a lot of pressure coming down on them from their systems. And so, but again, the patient has control. I mean, as a patient, you don't have to sort of step in line and do, you know, what it certainly is reasonable to do if you feel like you're in good hands. But if you feel like, boy, I want to make sure I'm seeing the best at, you know, whatever the condition you have is, then you have that choice, and nobody's going to sort of second guess you. You're not going to get any grief for doing that.
And do some research on your own, I think, is a good idea there too. Here's the information so that you can get in touch with Dr. Kandula at Advanced Ear, Nose, and Throat Specialist. Their office is located on North Mayfair Road in Wauwatosa. The phone number is there on your screen to make an appointment or just get a consultation or a second opinion. You can go to advent.md for more information too. And just really quickly, the most important question people should ask their doctor who suggests that they see a specialist
is, would you go to see that specialist yourself, or would you refer your family members to that specialist?
I think that's a good question too. Put them on the spot a little bit.
Yeah.
Thank you so much.
Thank you.
Good to have you this morning.
Thank you.
Still ahead on this